My name is Makeda Semret. I'm an associate professor in the Department of Medicine, Division of Infectious Diseases. I am a physician trained in internal medicine, infectious diseases, and medical microbiology. I work primarily as a clinician at the McGill University Health Center, where I also lead the antimicrobial stewardship program. The ultimate objective of my work, I would say of my research work, is to provide high quality care while preventing or limiting the rise of antimicrobial resistance in human health. With all the advances in modern medicine, we're now dealing with patient populations, particularly here where I work in a tertiary care hospital, where they present with increasingly complex chronic diseases that require procedures and therapies that will, for example, affect the immune system. They'll have long lengths of stay and ICU care, and they are therefore prone to developing infections. And in that setting, we tend to prescribe a lot of antibiotics. But the downside, of course, is we start getting very increasingly difficult to treat infections. I'm originally from Ethiopia. I've been actively involved in training Ethiopian physicians in infectious diseases for the last 11 years. So in the course of training infectious disease doctors and going back and forth, it was really visible to me that the testing platforms and the testing algorithms are so weak, and yet antibiotics are accessible. So the use of antibiotics is incredibly prevalent. I've been involved in this training platform and was also responsible for establishing an academic partnership with McGill University. We have been prospectively collecting data on the prevalence of antimicrobial resistance among patients that are presenting for hospital care in Ethiopia, and also in testing out interventions that could be useful to nudge clinicians towards optimizing their prescription practices and to inform policy efforts. By strengthening the diagnostic lab in a very focused way and specific feasible ways, and this is not millions of dollars, but in a very specific way, ended up being extremely useful for optimizing antibiotic prescriptions and antibiotic use in the hospital, and it ended up being also cost effective. So our previous work has shown those kinds of results. The value of MI4 is simply being connected to a very diverse group of very smart, very talented academics, people that I would never otherwise have met. So biochemists and engineers that I would never have met. We're actually looking at antimicrobial resistance from different patterns. And it turns out that just by talking together, sometimes we can help each other out in very unexpected and wonderful ways. So we did get together and decided that it was time to form an AMR center. So that's been one of the many perks of being part of the MI4 community.